Hi, this is my pocket guide assignment for NU 664 and 665. This is everything that I've put together over the last 2 semesters. So here's my table of contents with everything, like I said, that I've put together. So menstrual cycle first, and we have some pictures here, just scripting everything. Amenorrhea, primary, secondary, along with causes. PCOS, really good overview of symptoms. AUB with the palm coin acronym, along with lab testing for evaluation of patients with acute AUB, what we're looking for, medical treatment regimens as well, along with the contraindications on the side here, cervical cancer screening and guidelines, risk factors, subjective data, PAP results, interpretations of this, some DES exposure information, HPV vaccination and guidelines, contraceptive methods, a good overview chart here of all the methods for contraception, along with the effectiveness. And here's another one here. And then the time frame for everything on the bottom, just for a quick overview. Again, combined contraceptions, candidates, that are good, that are bad, MOA, progesterone, overview here. We have some stuff on hypothyroidism, symptoms and management, lab findings and when to follow up, along with the treatment plan, and hyperthyroid as well. Iron deficiency anemia, lab findings, treatment, things like that. Diet, I always like that. Hypertension, pharmacologic treatments, some indications, who to give it to, who to not give it to for medications. ACEs and ARBs for first-line treatments, along with dosing protocols, lifestyle management, again, some diet stuff in here. Hyperlipidemia, lab values, prevention methods, the doses of, high intensity, moderate, and then low intensity statin therapies. GDM, this is like an overview of how everything's working. And then this was a really good link, so I just included it on here. It has like diet, pharmacologic, non-pharmacologic interventions as well. Again, another little diet thing. I think this is really good for patients to see. I like this chart a lot for that. Sugar levels, what we're looking for. STDs, CDC has a great overview of all of these STDs. It has provider and patient education and information, so I just included the link there. UTIs and kidney infections, symptoms, what to look out for, tips for preventing, and then treatment regimens as well. And then we have a little bit of prolapse here, so a picture of, all the different types, treatment options, symptoms of that, endometriosis, symptoms, a really good overview here, treatment, and then a little picture here. Ovarian cysts, same thing, symptoms, how this starts, complications that could occur, torsion, rupture, along with treatment, and then again a picture here. Fibroids, same thing, so symptoms, medications, how we treat this, surgeries as well for this, ablation, traditional surgical procedures. And then we have the types here, like this picture. Good overview of menopause, what some symptoms of that are, average age 51, treatment, HRT, estrogen, low dose antidepressants, things like that. Home remedies, lifestyle changes, that's always good to, discuss with the patient as well, especially if they don't want any pharmacologic interventions, and this is just a really good overview of all the symptoms that can occur during menopause as well. Then we go into GI and onc. So ovarian cancer we have up first, I have signs and symptoms along with risk factors for all the different types here: endometrial, vaginal, vulvar, cervical, and then breast as well, a little bit longer. And this is a good, picture for describing everything, where everything is anatomy-wise. Infertility, so causes, I have both male, female, what to look out for. Testing, what we're going to do for men, what we're going to do for women. Treatment options for men, treatment options for women. IVF, ICSI, goes over everything in pretty good detail. Lichen sclerosus, symptoms of that, management, a lot of patient education and lifestyle changes in here to definitely talk with the patient about. Postpartum depression, something that's pretty important, going over baby blues versus postpartum depression versus postpartum psychosis. Postpartum depression in the other parent, something that's really not talked about that much, but I, wanted to include it in here. When to see a doctor, suicidal thoughts and resources. I really like to have this information so I can refer back to that, if I need to for any of my patients. Risk factors, that's important to review, at the beginning of pregnancy with patients. Complications, prevention. So during pregnancy, definitely look for and monitor, make sure the patient understands what this is and when they should alert, you, the provider, if anything is coming up. So that is what I have included in my pocket guide. It's about 60 pages and pretty good information in there. So thank you.